Is their arrogance their only friend? Why medical professionals are said to have their arrogance as their only friend. In popular discourse, the figure of the medical professional often straddles two extremes: the heroic, life-saving clinician, and the detached, arrogant individual ensconced in a fortress of knowledge and authority. The phrase arrogance as their only friend encapsulates the latter perspective, a rather scathing critique of the perceived overconfidence and social isolation exhibited by some within the profession. While undoubtedly unfair as a sweeping generalization, this sentiment arises from cultural, institutional, and psychological factors deeply embedded in medical training and practice. This essay explores the origins, manifestations, and implications of this arrogance, evaluating whether it is a necessary defense mechanism, an institutional byproduct, or a misinterpreted expression of confidence by an often uncomprehending public. 1. The rigors of medical training, birthplace of the ego. Medical education is among the most demanding and competitive forms of training in the modern world. In the United Kingdom, aspiring doctors must excel academically to even qualify for consideration, often achieving top marks across multiple A-levels and performing well in university admissions exams. Upon entry to medical school, they face a rigorous academic curriculum spanning a minimum of 5 years. These years are packed with lectures, laboratory sessions, clinical placements, and assessments designed to test both knowledge and aptitude for patient care. Medical students are expected to master complex scientific concepts while simultaneously learning to apply them in unpredictable, high-pressure situations. Unlike many other university courses, there is little room for failure. The stakes are simply too high. Those who succeed are often required to suppress their own doubts, constantly push beyond physical and mental exhaustion, and make swift decisions in environments where uncertainty is a constant companion. In such an unforgiving landscape, arrogance may evolve not as a character flaw but as a protective adaptation. A medical professional's certainty, even when bordering on conceit, is often mistaken for arrogance when it might be confidence forged through adversity. Moreover, medical professionals are expected to lead, advise, and sometimes make life or death choices, often without consultation. In such instances, hesitation may be more dangerous than perceived arrogance. 2. The culture of infallibility, institutionalizing arrogance. The medical profession has long been characterized by its rigid hierarchical structure. From medical students and foundation doctors to registrars and consultants, each level is marked by a clear distinction in authority, responsibility, and respect. While hierarchy ensures clarity and order in clinical decision-making, it also fosters a culture where those at the top can become distanced from critique and accountability. This structure often promotes the idea of infallibility, particularly among senior professionals. A belief may develop that experience equates to absolute authority, discouraging the questioning of decisions and limiting the scope for open discussion. As such, younger professionals may feel hesitant to challenge their seniors, even when they suspect an error, for fear of reprimand or professional repercussions. Within this environment, arrogance can be institutionalized rather than individually cultivated. The reverence traditionally afforded to doctors can create a bubble in which their decisions are rarely questioned, reinforcing a belief in their own superiority. Furthermore, the competitive nature of medical advancement, where consultants are chosen based on performance, reputation, and academic output, can lead individuals to prioritize assertiveness and self-promotion over collaboration and humility. 3. The emotional toll of the profession. Practicing medicine involves daily exposure to human suffering. Whether dealing with terminal illnesses, traumatic injuries, or life-altering diagnoses, medical professionals must constantly balance empathy with the need to function effectively. Emotional exhaustion, or compassion fatigue, is a recognized phenomenon in healthcare, and it can lead to professionals appearing emotionally distant or even indifferent. For many, arrogance becomes a shield against this relentless emotional onslaught. By projecting confidence and authority, medical professionals may be attempting to create psychological distance between themselves and their patients' pain. This defense mechanism helps them avoid becoming overwhelmed by the human tragedies they witness. Moreover, clinicians frequently deliver distressing news to patients and their families. In such situations, being overly empathetic may lead to emotional entanglement, compromising the ability to deliver care effectively. A calm, firm, and sometimes blunt demeanor may be necessary, even if it is misinterpreted as arrogance. It is important to understand that this outward composure often masks deep emotional turmoil. The cumulative effect of long shifts, missed meals, sleep deprivation, and intense responsibility can leave professionals with little energy for the emotional labor of appearing endlessly approachable and understanding. Over time, this can lead to the internalization of a persona that appears aloof or arrogant, even if it is primarily a method of emotional self-preservation. 4. The misinterpretation of authority. Authority, particularly in a clinical setting, can easily be misconstrued as arrogance. Medical professionals are trained to make decisions based on scientific evidence, experience, and clinical guidelines. However, when these decisions conflict with patient expectations or popular narratives found online, friction can arise. Patients today are more informed and empowered, often entering consultations with preconceived notions of their conditions. When doctors challenge or correct these assumptions, they risk being perceived as dismissive. Furthermore, communication styles differ widely between individuals and cultural contexts. In the UK, modesty and understatement are often socially valued, and overt confidence may be misinterpreted as arrogance. A doctor asserting their clinical opinion in a straightforward manner, particularly in time-sensitive scenarios, may not have the opportunity to couch their delivery in empathetic language. This misalignment between professional necessity and social expectation leads to a common misconception that confident, authoritative behavior is inherently arrogant. In truth, many such interactions are shaped more by time pressures, diagnostic urgency, and systemic constraints than by individual personality traits. 5. When arrogance becomes a problem. Although arrogance may serve as a protective mechanism or a misinterpreted form of confidence, it becomes problematic when it impedes clinical judgment, undermines teamwork, or erodes patient trust. An overconfident practitioner may become dismissive of alternative diagnoses or second opinions, potentially leading to errors in care. In extreme cases, arrogance can foster an environment of medical negligence or unethical conduct, particularly when practitioners believe themselves to be beyond reproach. Arrogance can also stifle collaborative practice. Modern healthcare increasingly relies on multidisciplinary teams, where nurses, physiotherapists, social workers, and others contribute to holistic patient care. An arrogant clinician may disregard these perspectives, undermining team cohesion and jeopardizing patient outcomes. For patients, the experience of being talked down to or dismissed can be deeply alienating. It discourages open dialogue, reduces compliance with treatment plans, and diminishes overall satisfaction with care. When patients feel their concerns are not being heard or respected, it undermines the therapeutic relationship, often irreparably. Thus, while some measure of confidence is essential in the medical field, unchecked arrogance can create serious risks. Medical professionals must remain vigilant against the temptation to conflate authority with superiority. 6. The erosion of the doctor-patient relationship. Over the last few decades, the traditional doctor-patient relationship has undergone significant transformation. The rise of the Internet, greater access to medical information, and increased awareness of patients' rights have shifted the dynamic from paternalism to partnership. However, this transition has not been without friction. Patients are more critical and less deferential than in the past. They expect shared decision-making, clear explanations, and compassionate care. In contrast, medical professionals, facing unprecedented workloads and resource constraints, may struggle to meet these expectations. When communication fails, and expectations are not aligned, patients often interpret detachment or brevity as arrogance. The pressure of modern healthcare systems, particularly within publicly funded services, compounds the problem. Appointments are often brief, waiting times are long, and staff shortages are common. Under such constraints, doctors may appear rushed or uninterested, not because they do not care, but because they are overburdened. This structural reality is often invisible to patients, who interpret their experience solely through the lens of their interaction with a single clinician. This disconnect exacerbates tensions and contributes to the perception that medical professionals are arrogant and uncaring, when in fact they may be struggling against a system that affords them little room for genuine human connection. 7. The rise of empathetic medicine, a counterbalance. Despite the persistence of the arrogant doctor stereotype, there is a growing movement within medicine that champions empathy, humility, and patient-centered care. Many medical schools now include modules on communication skills, reflective practice, and cultural competence. These efforts aim to produce clinicians who are not only technically skilled but emotionally intelligent. Younger generations of medical professionals are more attuned to the importance of bedside manner and holistic care. Many actively seek to dismantle the hierarchical and paternalistic models of the past. The diversification of the medical workforce also plays a crucial role. As more women, people from ethnic minorities, and those from diverse socio-economic backgrounds enter the profession, the values and communication styles of the medical establishment are evolving. Furthermore, the increased integration of allied health professionals into primary and secondary care has helped foster a more collaborative approach to healthcare. These professionals often bring different perspectives and interpersonal skills that challenge the traditional dominance and perceived arrogance of doctors. As a result, the modern patient experience is increasingly shaped by a team-based, empathetic model of care. 8. Conclusion, friend or foe. To say that medical professionals have arrogance as their only friend is to express both a cultural frustration and a psychological observation. It reflects the discomfort of encountering a professional who seems emotionally distant, intellectually intimidating, or dismissive. Yet this view oversimplifies a complex reality. Arrogance in medicine is often a product of the intense demands, institutional structures, and emotional toll that define the profession. It may emerge as a protective shell, a learned behavior, or a misunderstood expression of necessary confidence. While it can be harmful when unchecked, in many cases it masks vulnerability, fatigue, and the relentless burden of responsibility. The challenge for modern medicine is to balance the confidence required to save lives with the humility and empathy needed to care for them. Medical professionals must strive to remain approachable without compromising their authority, to lead without dominating, and to heal without retreating into emotional isolation. Arrogance may sometimes accompany the role, but it need not be its defining feature. Ultimately, the best doctors are not those without arrogance, but those who understand its origins, resist its excesses, and prioritize connection over conceit,